Hey everyone, thanks for stopping by my channel, The Casual Caregiver. My name's Tiffany, and amongst other things, I'm a caregiver to my dad who has dementia. He's 72. He was diagnosed about 4 years ago or so, maybe 5 at this point. And he resides with me, and I'm his primary caregiver in the home. So this channel was created to share my experience and whatever tips I have that might be useful. This particular video is sort of catching you up on the recent happenings and telling you about dementia neglect. So to start, my dad was just hospitalized for an entire week. This started because we went to his doctor's appointment. We took the MARTA mobility bus, so this was our second official ride. And when we returned home, he'd vomited himself. To preface this, he spit up the first time we took it, so one would think, okay, a little motion sickness because you're in a bus. It's not like sitting in the car. And even when I'm on the bus with him, I'm like, oh God, get me off this bus, okay? I don't like people driving me, so it's kind of hectic for me to sit on the bus, but I do it because I don't want him riding by himself, of course. So we come back from his appointment. He's kind of leaning over just a bit. He vomits on himself on the bus. So that was a whole thing. I had to run in the house. I got my gloves, my Lysol cleaning stuff because there were 2 other patrons on the bus. I cleaned everything up very well. The bus driver was thankful because he was like, oh my God, I got to get another bus for the ride. I'm like, bro, calm down. I've got gloves. I've got all the disinfectant you would ever need. So we got him in the house. He was just a little tired, still leaning a little bit, but that's not unusual for him. After we take him out for his appointments, even when I'm driving, he's tired. You know, switching up his routine, taking him places makes him tired. It's a lot of stimulation, sounds, people, they're talking to him. It's a lot. So nothing unusual. Until the next day, we realized he was a little lethargic, and my mom really wanted me to get him looked at in particular because he wasn't really using his left arm as much. He doesn't use it often anyway, or as often as he used to, because he is right-handed, and primarily things that he wants to reach for are always on his right side. When he's sitting in his recliner, his table is on his right side. So nothing unusual to me, but it was a little bit worse by the end of the day. I was like, okay, maybe he heard it while he was sleeping. I don't know, right? I'm trying to make sense of what happened. So long story short, my mom really wanted me to take him. I didn't want to because I already know when you take him to the hospital, typically they send us back home. They don't even keep him overnight. Even if it were like a seizure, they don't keep him overnight for seizures because seizures are part of his condition. He has amyloid plaques in his brain, which is like, think of it as they're little clots is what they are. But you can't take blood thinners because if he were to take blood thinners, he'd essentially just kind of like bleed to death is what would happen. Any bump, anything, that's kind of what would happen. So it's sort of regular course of action. If he has seizures and it only lasts a quick minute, then he's going to be a little tired. You just have to make sure, of course, he don't choke, anything like that. And then we're good to go. We don't have to rush and take him to the hospital every time he has a seizure. And he doesn't have them that often. So we're sort of prepared for that. I've been through a couple seizures with him now. I'm not going to freak out. I'm very much like, make sure his tongue isn't going, but make sure he's not laying on his back, lean him on his side. It's second nature now. But in this case, the hand, it was the lack of use of the left hand, or lessened use of the left hand. The leaning towards the left a little bit. He's had a stroke before, a little stroke, and that leaning and that sort of lack of use of a side is one of the symptoms of a stroke. However, when he has a stroke or any sort of major moment like that, the stroke, the main thing is his mouth. Once I saw that face droop, you will never get that image out of your mind, by the way. The first time you see someone have a stroke and you see that drooping face, you will recognize it in anyone moving forward. So especially your loved one, if you know their normal situation and normal facial structure. So there was no drooping We talked to the nurse practitioner about it, and she's like, this sounds like this might be just more so tied to being tired or possible just pain, because he does have arthritis as well. It's like a perfect storm of things, right? But one thing she did have us do is she had us reach out to urgent care. She gave me information for an urgent care that actually is mobile. I will put the description for you all below just in case they are in your area, because I will use them forever moving forward. So they come to your home, but before they come to your home, they triage you with what's going on. So I reach out to them, they talk to me, they ask me a few questions, and after I say he vomited and he's a little weak with the left hand, they said, pause right there. Nope, we're not coming to you. Take him to the emergency room. I was like, oh my gosh. Needless to say, we took him to the emergency room, and I'm glad I did, because they kept him for a week, right? So they did so many tests. They had neuro come, they had MRIs, CTs, they had this of the head, the neck, the hip, because he does have a wound that's been healing over time on his hip. But because he's had hip replacements, they always want to make sure that infection isn't getting to the hip, because that can cause issues too. A whole host of things happened over the course of that week in the emergency room, including me having a birthday and all sorts of things, right? He was there. He did pretty okay. In the beginning, he didn't want to eat anything from the first nurse, who was a male nurse. He didn't want to eat anything. But my dad has a fantastic appetite, so they were concerned about him not wanting to eat. And I was like, listen, it's just because he's a man, and it's not me or my mom. Like, his brain isn't all the way there, but he knows that he's in this place, and he knows that you're a guy trying to feed him, and he's not here for it. So he's only ever been weird with, like, the male nurses. So I kind of chuckled at that. But this is the whole point. The neurologist, super great, okay? He did some manual tests of his own and explained something to me, a concept I've never heard of before, called neglect. Now, of course, as I'm standing there in the emergency room after being there 9 hours this first time, he said he's experiencing neglect. And I'm like, what? No, he's not. I am taking care of him. My mom is taking care of him. He is good. He's like, no, not that kind of neglect. He's neglecting part of his world. He's neglecting his left world. He didn't have a stroke. It's just that he's experienced an additional step down. So he's declined. And the way this decline is showing up is he is neglecting the left part of his world. I'm like, what? And then it started to make sense as he went on. So the doctor, just imagine you're looking at me, except I think this is reversed because I'm in a video. This is my left side. The doctor was standing over here while my dad was sitting in the chair. And he's like, let me show you something. The doctor's over here. He starts yelling his name. He starts clapping, snapping, acting like he's punching at his eye, doing all these things, flashing a light. My dad is just nothing. I'm calling his name from this side. Nothing. So then the doctor rolls his chair and goes like this in the middle. And my dad all of a sudden goes, huh, like he scared the crap out of him. Goes to the right, does all the same stuff. My dad is jumping. He's doing this. He's jumping because he's getting startled. And that made so much sense to me about some of the things I've noticed, but never thought anything of. Like, my dad has always been good at, like, ignoring you if he wants to ignore you. But what it is he's neglecting this side. So it doesn't mean that it doesn't work or like it's broken or that it hurts. That's why he's not flinching when we were doing any of this shaking and moving of the arm. It is that he's just neglecting the left side of his world. And it clicked. My dad's chair in his room, when you walk to the door, I guess when you're looking at the room, he's to the right side. So we're on his left side. Sometimes since the chair is at an angle, sometimes he sees us when we walk up, especially if we're coming from the other way down the hall. But if I come from this way and go in the room, I could say, hey, how you doing? You know, dance, I snap, whatever. He doesn't do anything. Sometimes people call his name. He ignores them. And that's why, because he's neglecting the left side of his world for the most part. So when we are doing things that he would then see from his left side, he is not that he's ignoring us, but it's not registering. He can still see, because there are times when you can come to the left, and when you come to the left and he'll respond or, you know, whatever. But this was new for me. I didn't know that it had like a name and that it was a thing. I don't recall this being a thing or ever reading about this anywhere. So I want you all to be aware of neglect and what it could show up like in your loved one, or what a decline could look like in your loved one. Like, there's some things that pretty much everyone with dementia gets, like the sundowners and things like that, or that are consistent. I won't say everyone gets it, but there are others that I think are more nuanced. It depends on the person, and one, their type of dementia, two, their age, and any other factors. But I really wanted to share this story about dementia neglect with you because I didn't know. So now that I know, I will make a point to come around his right side so that he sees me, and I'll come slowly so that I don't scare him, because I mean, you don't want to startle your loved one, right? But overall, this week-long stay, he's back home, and it's just something else that I've learned as part of my journey. And I really hope this is helpful to you as well, because I didn't know. And you don't know what you don't know until someone tells you, or until you experience it yourself. And I'll wrap this up by saying, if at any point you notice something with your loved one and you're unsure, even if it doesn't seem like if they're in pain, just like how he was a little bit weaker with the left side, with the vomiting, just go ahead and take them in if you can, whether it's taking them to the ER, dialing 911, or, you know, contacting urgent care. Go ahead and give yourself that peace of mind and get validation and verification, okay? So I will leave that link for the urgent care down for you. As long as I still have it, I'm leaving it for you in the description. And if you have any questions for me about my experience in general, or about this dementia neglect, please do leave a comment below. I'll be sure to get back to you. Thank you so much for watching, and I wish you all the best as you care for your loved ones on your journey. Bye.